Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Anand Shah. He's a cardiology and preventive medicine fellow. Today's Kevin MD article is The Role Generative AI Can Play in Cardiovascular Education for Patients. Anand, welcome to the show.
Thank you. I'm excited to be here and thanks for having me.
All right, so let's jump straight into that Kevin MD article. What led you to write it in the first place?
Yeah, I would be happy to tell you. So I really got into this article as I've started using generative AI for myself, especially with open evidence, and realized that this is a tool and type of thing that patients could actually benefit from something very similar to it. And from that, it really had me take a step back and made me realize that when we look at our healthcare system today, it's pretty clear that we struggle a lot, particularly on patient cardiovascular education.
Yeah.
And I mean, we're really good at managing acute presentations and have the infrastructure set up for that. But when we're talking with patients and managing their day-to-day lifestyle choices and diet, it's clear how much we're lacking. And I mean, it's clear everyone knows that
Yeah.
we need to eat right and exercise more, but to do so is very difficult. And in our 15 to 20-minute encounters with our patients, we really don't have the time or training to really work in depth with them and help them with their dietary choices. And this leaves us with being able to leave them with kind of vague advice of avoid fried foods, avoid eating fatty foods, exercise 150 minutes a week. But unfortunately, those type of vague advice doesn't give them the support they need to make those day-to-day changes. And I think this is where generative AI can really change the game. And I was experimenting with ChatGPT and really tried to feed it different prompts and got to the point where it could give me a week-long meal plan schedule for that kind of improve cholesterol and hypertension levels. And as I prodded further, it made that into a grocery list and could even give the amount of the expected price for that based on my location. And I think the potential is very incredible. And if we look and see how if we can guarantee a model that uses very validated information that can be fed to patients, it could be really game changing and have such a large impact on patient outcomes.
So talk a little bit about that knowledge gap. You went from kind of like, the vague advice that typically is done on the patient handouts whenever we give patients to the shopping list that generative AI can create. So in general, talk a little bit about that gap. So you're obviously a cardiology and preventive medicine fellow. What kind of information in an ideal world would you like patients to have?
Yeah, I think it goes to a lot of our choices and the dietary habits kind of happens on a day-to-day basis or week-to-week basis. And unfortunately, as clinicians and providers, we can't be there realistically to kind of hold the hands of patients or have them ask like, oh, what should I eat this coming week? And unfortunately, while we can get them plugged in with nutrition and even in our visits kind of give general advice of limit carbs to this amount, limit fatty foods, or increase fruits and vegetables, it's tough to translate that into a very tangible list of, hey, these are the meals you can make and these are the ingredients you should buy. And I think generative AI could potentially fill this gap where using kind of the guidelines and what we know in terms of the balance of the meals as its foundation can screen it and screen meals and say, hey, these are the exact meals that can fit these recommendations, and this is what you should purchase to get that. And unfortunately, as clinicians, it's again pretty infeasible and not part of our training to kind of dive into those weeds where we appropriately are concerned a lot with the medicines, the pathophysiology. How do we kind of prevent another cardiovascular event, but we're not trained in kind of having those detailed, these are the meals that directly lead to that.
Yeah, you're absolutely right. I've talked to many physicians in terms of the training that they normally get when it comes to prevention and nutrition, and it's very, very limited. Obviously, you specialize in this. So just speak to that lack of education that most primary care physicians don't have when it comes to traditional medical training, when it comes to prevention.
Yeah, and I think it's just a function of the system, and I don't think it's wrong that we have so much other to be trained on and just a wide swath of medical information that is very relevant and tied to medications and really tied to the randomized trials. And for nutrition And there's not that many trials that really have proven benefit. And a large reason for that is there's just no financial incentive to
Mhm.
run those trials where, yes, we know kind of the Mediterranean, the DASH diet can reduce hypertension, but even within those trials, there's kind of disparities in actually how much each patient was actually on those diets. And so it really dives into there's not that strong foundation of randomized trials and knowledge that links certain things, but we do know certain nutritional components and a variety diet can make a difference. It's kind of translating what we do know and giving it to patients so that they can act upon it. And I think it makes sense in our traditional patient encounters where we don't have the time or flexibility to dive into those
Mhm.
kind of day-to-day things. And again, it comes to how do we balance and utilize the time we have with patients and make the most of it.
So tell us about some of the prompts they use on ChatGPT to create a grocery list and some recipes and some specific dietary changes for your patients. How did you come up with these prompts and what were some of the exact outputs that came up from ChatGPT?
Yeah, would be happy to share. Uh, and I haven't done too much with like kind of recommending patients to really dive into this just because I know the ChatGPT models, et cetera, aren't extremely validated in this regard. So I don't want to give my patients wrong information or
Yeah.
kind of feed them anything that could potentially cause harm. But in general, as I've kind of started the prompts and as I've explored just from my own curiosity and learning, I've really kind of based it off of, hey, based on the ACCHA guidelines, what should we do for this? And I'm hoping that that kind of draws upon established literature and focused on that because I did notice I got different responses in terms of what weekly meal plan would be if I didn't preface it by saying follow these guidelines
Hmm.
versus something else where I think in the general internet where it's going to find maybe more unhealthy recipes that are more popular versus if we kind of focus it and prompt it to do it based on guidelines, we're getting that truly healthy Mediterranean type diet. And what I was really impressed by and mentioned in my article was this can be really personalized to the individual. I was
Yeah.
able to kind of start with the initial meal plan and the weekly schedule, but then when I said, hey, what about a East Asian or Indian kind of cuisine spin on food? It was able to generate a meal plan for that. And I thought that is what is truly impressive with generative AI, where it can be customizable and personalized to the individual, where language barriers, the level of education, even the type of food can be easily adjusted without
Hmm.
having to call your nutritionist, wait a few weeks, et cetera, for another visit to create a meal plan. And this is really at the fingertips.
So through your use of ChatGPT and your lens as a cardiology and preventive medicine fellow, is the information that you're getting back generally pretty good? Is it something that could be relied on? I don't expect it to be 100% medically validated because even if you do a Google search, that's not the case either. But through your lens as a physician, how is the information that you're getting back from ChatGPT?
I think overall, especially if I'm like prompting it by saying, hey, use these guidelines, the type of meals that I'm seeing seem to really capture the lean proteins, the heavy vegetables, avoiding certain types of like fried and fatty foods. It overall it seems to surprisingly capture that really well. And I think the what makes this really great is it kind of reduces a burden where even when I'm shopping and trying to figure out my
Yeah.
meal plan for the week, it takes time and effort to do so. So, and with people's busy lives and schedules, it's often the easy thing is go get fast food, go get
Yeah,
whatever
yeah.
you're familiar with. So, if we can really integrate a way to reduce that barrier for patients and give them an easy way to say, hey, this is a healthy meal that didn't really take much time for me to think of or to create the grocery list. Maybe it will tip people to actually being able to follow something that and just make it more reasonable.
Now, give us some scenarios where you would incorporate generative AI into a typical patient visit. So, how exactly would you introduce that, and how would you expect patients to use ChatGPT?
Yeah, and I think that's the next like $1 million question. And for me, I think it's more of kind of a introductory thing where
Yeah.
I'll, if a patient expresses interest of, hey, I'm trying to eat well, but just can't figure out the best way, I can say, hey, why don't we just pull up ChatGPT together and
Yeah.
see what comes up and kind of bounce it that way. And fortunately, being at an academic center and being a trainee, I have a little more time to spend with patients, but I know that's not the case in most clinical settings where time is such a valuable and limited resource. But I think it's, again, goes back to working with the patient one-on-one and walking them through it. And realistically, we also rely a lot on a nutritionist. So it can be saying, hey, let's see what this spits out. And when you meet with the nutritionist next time, we can walk through it with them and just make sure from their standpoint and utilizing their expertise that we're doing what's right by them.
Now, from what you're seeing, what's the general AI literacy of patients? Are you finding patients are already using ChatGPT or other large language models to answer some of these questions about their condition, or are they still at the Google stage, Googling their diseases? So, what are you seeing in your clinic?
Yeah, I think it's a pretty wide spectrum and depends a lot on the demographics, the clinic setting. But I think it's such a wide setting. There's many patients who's still having flip phones and
Yeah.
having trouble even getting connected to video visits, while on the other end of the spectrum, patients are coming in with all these recent clinical trials, et cetera. I think for the most part, and it really goes down to, I think, a lot of privilege where a lot of the more well-off, privileged patients are being able to take advantage of some of these resources and are knowledgeable about them, but our less privileged patients, unfortunately, don't have the time resources to really dive into it. And that's one thing I think generative AI and AI in general can hopefully, and the goal would be to kind of bridge that gap and be a low-hanging, easily accessible resource for all that everyone can kind of benefit from it, and we're not worsening the divide in the quality of care.
Now, how about among the medical community, some of the attendings that you work with and other fellows and residents? Are they embracing AI to the extent you are and seeing it as a positive tool going forward for patients?
I think so. I think it's generally, at least with a lot of my co-fellows and the attendings, that especially there's been a lot of talk about open evidence, and at
Yeah.
least everyone I've talked to has been using it, and it's a very valuable resource. And again, it's not perfect, and I've even noticed kind of flaws and inaccuracies in the answers it gives, but it really condenses things and makes it very easy to pull a literature review or just what's out there on a specific question or topic and makes it easily engageable. And so I think there is a lot of good hype around it and use of such resources. The question is how do we get it integrated within our workflows and get it so that it can help us and not just be something that's difficult to access and truly utilize. But I think there's a lot of good emphasis on it and people are very excited. It's just a matter of how much and what it can actually do to really help us take care of patients better.
You mentioned open evidence for those who aren't familiar with it. It's a large language model. It's kind of like ChatGPT, but it's based on established medical literature. Is that correct?
Yes, it is. So I think that's what makes it really great for clinicians, where we know the model and the data and literature it's being trained on and can trust that it's from kind of already peer-reviewed journals. And so it's not just picking up and giving us information from anywhere on the internet, but from validated studies. But again, I think one thing I've also taken away is it is very important to understand kind of the fundamentals of
Mhm.
medicine, biology, where we don't want to just only rely on that large language model outputs and take it for that this is the golden truth, where unless we have that medical knowledge, it's important to be able to kind of parse out and get a lot of those intricacies of, hey, this part of what it's saying is true, but this other part isn't. And being able to kind of have that conversation and press the language model to be aware of that.
We're talking to Anand Shah. He's a cardiology and preventive medicine fellow. Today's Kevin MD article is The Role Generative AI Can Play in Cardiovascular Education for Patients. Anand, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, would love to. So I think my take-home message, even though I think it's a little cliche, is just follow your interest. And for me, my interest in preventive medicine and cardiology, I've gotten really excited about AI and its potential to really help us take care of patients better and help patients in their day-to-day kind of lifestyle and dietary choices. But I think each of us has our own gifts and backgrounds and interest, and all of that can drive positive change in medicine. And there's so much low-hanging fruit where if we all just really dive into our interest and keep exploring them, I think we can make a positive change for patients.
Anand, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Yes, happy to be here, and thanks again for having me.